Good afternoon.
Hi.
My name is Eli, and I'm going to be your student nurse today. I'm going to go ahead and lay this by the bed here. Practice some hand hygiene. Now, before we get started, can you tell me your name and date of birth? Perfect. All right, I'm going to double check that with the system. And everything seems to check out. Additionally, can you tell me if you have any allergies, such as latex?
No, I do not.
Perfect. Okay, I'm going to go ahead and grab some gloves. So for the purpose of today's video, we're going to demonstrate how to appropriately assess a patient's specific vital signs, the specific ways to do that, where to do it, how to do it, etc. So the first vital sign we'll start with is a patient's temperature. The range you're looking for is generally anywhere from 96.4 to 99.1 degrees. And for the purpose of today's video, the two specific routes we are going to demonstrate will be the oral thermometer and then the tympanic thermometer. Another thing to keep in mind when using thermometers, always maintain aseptic technique if possible by using a plastic sheath. Additionally, before assessing for a patient's temperature, ask if they've had any food, liquids, or if they've smoked. If they've had in the past 10 minutes, wait 10 minutes and then assess after that. So first we will start with the oral thermometer. So the first thing you'll ask the patient to do after making sure there's a sheath on there is open their mouth, lift up their tongue. You will insert the thermometer under their tongue and then ask them to close their mouth as usual and allow the thermometer to measure their temperature. Then for a tympanic thermometer, once again, plastic sheath, aseptic technique. For an adult, you will pull up on the helix of their ear, and for a child, you'll pull down on the lower lobe. The reason you do this is to straighten out the auditory canal. This allows for a more accurate measurement for the thermometer. Next, we will move to the patient's pulse, their heart rate. Typically, the range you're looking for with this is anywhere from 60 to 100 beats per minute. There are two specific ways you can do this. You can do it by measuring the radial pulse or the apical pulse. The apical pulse is actually more preferred. It's most accurate, but it's also most invasive. So generally, nurses start with the radial pulse itself. Now to do so, you'll use these two fingers. You will palpate the patient's radial artery. Let's see if we can find it here. Yep, we got it. And you will measure, for the purpose of today's video, for 30 seconds, then multiply the value you find times 2. So let's see here. So the pulse I found was about 44 beats, so multiply that by 2, that'd be 88 beats per minute. It's well within the normal range, nothing to worry about. Now the reason most nurses actually only measure the radial pulse for 30 seconds is for the next 30 seconds, they measure the patient's respiratory rate. And the reason they do this is they don't want to instruct the patient that they are doing this, or let them know rather, as patients can actually voluntarily control that. And you want a general, not autonomous, just good measurement without any patient interference. So the range you're typically looking for at the respiratory rate is anywhere from 12 to 20 beats per minute. For the purpose of today's video, I'm not going to make you watch that, but we would do that for the last 30 seconds of the minute. With an apical pulse rate, we would do that for a full minute. That's how you measure that. And the way you find the apical pulse site is you locate the patient's left mid-clavicular line, and then you go down to their 5th intercostal space, and you would stick the diaphragm of the stethoscope in that area. Now, some specific things to keep in mind. As we said, it is most invasive, so you're not just going to lift up the patient's shirt and begin the assessment. Additionally, because you need specific diaphragm skin contact, it is very important that for a patient with more adipose tissue or a female, that you may have to ask them to assist you in lifting of the breast and things of that nature. Now, the next assessment we'll move on to is the patient's blood pressure. So the first thing we will do is grab the blood pressure cuff, and we'll make sure that it is the appropriate size for the patient, as patients can come in all shapes and sizes, so do the blood pressure cuffs. Some specific things to keep in mind for blood pressure, much like temperature. You will ask the patient if they've ingested any food, any liquids, or if they've smoked in the past 30 minutes. If they've had, you wait 30 minutes before assessment. So we will place the cuff on the patient's arm. Thank you. Perfect. All right, and And the way you can check and see if the cuff is the appropriate size is you can take these two fingers here, place it in the cuff. If it fits without too much snugness or too much looseness, it's the right size. Now, as you can see, there's a label here indicating where the left artery, right artery is going to be. Perfect. So what we will do first is we will palpate the patient's brachial artery. We're looking for a blood pressure anywhere from 110/60 to 139/79. Now, the specific things we're looking for with the palpation specifically are the Korotkov signs. Those are going to indicate where the systolic pressure is and the diastolic. You'll know the systolic when you first hear the sound click, and you'll know where the diastolic is when you no longer hear a sound. So I've got the cuff appropriately on. We're going to deflate the cuff, make sure it's deflated. Crank this knob back to the right. We will inflate the cuff just beyond the upper range of what's appropriate for a patient's blood pressure. We will palpate, and when we no longer hear or feel, when we first feel palpation, that's when we know the systolic has begun. Okay. So I measured about 112 right there. That's within the appropriate range. Now, if you're going to, is that okay? If you're going to auscultate a patient's blood pressure, generally you would wait a full minute between palpation and auscultation. For the purpose of today's video, we're just going to go ahead and do it. As such, this could lead to a false high reading. So that's a thing we have to keep in mind when we get this value. Additionally, we mentioned false high or low readings just now. When you're going to do blood pressure, make sure the patient's legs aren't crossed. Make sure that their arm is placed on a flat surface, not above their heart, things of that nature. So we're going to go ahead and we are going to auscultate. So we'll place the stethoscope in our ears, place the diaphragm and the cuff of their arm right there, where the brachial artery is. Once again, we will look for that appropriate range. We will deflate the cuff all the way, inflate the cuff, and listen for the first sound, the systolic, and the cessation of the sound, the diastolic. Okay, so I measured that to about 118/68, well within the normal range. A little bit higher, that's to be expected. The last vital sign we will assess for is O2 saturation. We will do that by using a pulse oximeter. Now, a specific thing to note, once again, we don't have that specific tool with us, so we'll just have to verbalize it. What we would do is we'd grab the pulse oximeter, we'd use the patient's index finger and place it on their index finger. Before doing so, we'd assess, see if they have any nail polish, anything on their fingers. We'd remove that. The tool can't be used appropriately if there is anything on their fingers, anything obstructing the measurement itself. We'd allow it to sit, measure their O2 sat, and do its work on its own. Ideally, you're looking for anywhere from 96 to 100 O2 sat in a healthy patient. As this is a healthy young female patient, it'll probably be in the upper 90s, if not 100 itself. There are certain conditions, however, that such as COPD, where it may be no higher than 93, and that's to be expected. Now, some abnormal things to look for, some reasons we are looking for these specific ranges. With temperature, you want it from 96.4 to 99.1. The reason you look for these specific ranges is anything outside of that range could be signs of fever, illness, infection, things of that nature. With the pulse, we mentioned 60 to 100. If, for instance, the patient has a pulse that's higher than 100, this is signs of tachycardia. That's not good. Subsequently, if their pulse is less than 60, that's bradycardia. That's too slow. That's not good. So a real application of this would be the medication digoxin. If you're going to administer digoxin to a patient, you have to measure their apical heart rate for a full minute. And if their apical heart rate isn't at least 60, they're experiencing bradycardia, you would administer the medication. With the respiratory rate, we mentioned 12 to 20. This is important because if they are less than 12, this could be signs of bradypnea. They could be experiencing a depressive episode. If they have greater than 20, tachypnea. This can be signs of like a panic episode. Then we have blood pressure. If a patient is under the ideal range, this could be signs of hypotension. A real-world example of this would be like the medication rapid-acting insulin. Insulin naturally, it acts to drop a patient's blood sugar, but a thing you have to look out for is hypotension. If the patient's blood pressure gets too low, you're not going to administer this medication. With hypertension, if it's too high, things you have to look out for are stage 1, stage 2, general obesity, things like that. The reason this is important, as obesity could lead to further health complications. So that's why you want the blood pressure in the appropriate range. And we mentioned COPD with the O2 sats. So finally, you would maintain patient dignity, place the bed in the lowest position possible, raise the handrails. You would let the patient know if they have any further needs. They can contact you. You have your light there. Once again, my name is Eli. I hope you get to feeling better. If you need anything, contact me. Remove your gloves, get the last of your tools, administer hand hygiene on your way out, and you're done. Did I get the hyper